And here with answers to your medical questions in our Ask the Doc segment is Dr. Masante Levine. So just strawberries and blueberries? Can you eat more than that?
I think that's a good start. I mean, we talk about eating 4 to 5 servings of fruits and vegetables a day. Blueberries are at the top of the list, including raspberries and strawberries, kiwi. I think a lot of people like eating bananas. That's probably lower on the list. The melons are pretty good fruits as well. So I advise all patients, even in my practice, to try to get in your fruits and vegetables every day because it does impact your health. A lot of people consume a lot of vitamins over the counter. They may take a handful of multivitamins, and there's a big controversy out there about whether or not vitamins are better or fruit are better. In my opinion, the fruit are better. It has everything that you need, in particular the blueberries. It packs a huge punch. It provides a lot of antioxidants. As I've mentioned on this show before, as we get older and as we get more overweight, our body is more inflamed, more stressed, and you want something to help fight that inflammation. And blueberries and strawberries does that quite well. So you should be consuming that on a regular basis if you want to be healthy and you want to fight inflammation and disease. That needs to be a part of your diet.
Does it matter if you have the fresh blueberries and strawberries, or can you opt for the frozen?
I think frozen is a good option for those who, for whatever reason, like frozen vegetables or frozen fruit. However, to be honest with you, you want to eat it as true to its natural state as possible. Anytime you introduce processing, that tends to corrupt the fruit. It tends to take away the nutrients and vitamins that you're trying to get out of the fruit. So you want to take it from the ground to your plate as quick as possible. The longer from the ground to your plate that you have, the more processing is involved. The more it takes the nutrients out, and it's not as powerful as eating it as fresh as possible.
All right, on to some of our Facebook questions. This person wants to know, if you haven't lifted anything heavy or strained, what could cause blood to come out in your stool?
A lot of times it has nothing to do with straining. The most common cause of blood in your stool would be anal hemorrhoids. Certainly if you're 50 or above or you have a strong family history of colon cancer, we're always concerned about malignancies that's causing blood in the stool. You can have abnormal blood vessels in your stool called arterial venous malformation, or AVM for short. You could have ischemic colitis. That can cause blood in the stool. So a whole lot of issues going on. It depends on the other symptoms you come to the doctor's office visit with, but anal hemorrhoids is the most common. Typically has nothing to do with straining.
Okay, another person wants to know, what is SIDS and is it curable?
It stands for sudden infant death syndrome. They don't know the cause of that. A lot of times they try to get parents to position their kids a certain way so that they will not potentially suffocate at night. The true cause, however, is not known, but positioning the child seems to make a huge difference.
Okay. How often should a person with sinus infection use a saline neti pot? This is what I use, and it cleared it up pretty fast. I use it in the morning and again before I go to bed at night. I was told by friends that they heard that you're not supposed to use saline solution, neti pot, twice a day, that was too often. It worked for this person, no problems, but if it's not safe, I don't want to overdo it.
Well, I don't think it's going to kill the person or have an adverse reaction. You know, we try to stay away from antibiotics as much as possible. We try to teach patients to try to put themselves in a position where they have less flares, less infection, and the neti pot seems to be a very good alternative. These things are over the counter. In terms of once a day, twice a day, I'm actually not quite sure. I think once a day would be good, but you know, there's some people who need 3 times a day, and I don't think there's anything in the medical literature right now that says if you do it 3 times a day, then you're going to have a worse outcome if you do it once a day. So just kind of listen to your body. Certainly you can talk with your physician, or some people are seeing ear, nose, and throat doctors, especially if you have a lot of chronic sinusitis, that might require more aggressive care.
Is there a particular type of water? I know that in the past we've talked about using tap water versus the distilled water.
I personally don't have any preference, and again, we like to rely on medical literature and guidelines that tell us those things. As far as I know, there is nothing like that. Certainly if you want to use Perrier or something of that nature, I mean, be my guest, but certainly just try to stick to the tap water. You know, it's pretty clean, and again, you have to understand there's bacteria living in our sinuses all the time, so it's not like you're going to introduce something that's not already there.
All right, Dr. Levine, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Masante Levine to answer more of your medical questions. This person wants to know, what's the difference between a stroke and a TIA?
They're basically the same, just wording. A stroke is kind of like a TIA is kind of like a mini stroke. We throw that term around a lot. Typically symptoms would involve numbness of tingling hands or legs, can't talk, can't walk, sometimes blurry vision, vertigo, TIA is kind of like I said, a mini stroke. A stroke is normally something that lasts more than 12 to 24 hours for most patients. A lot of cardiac risk factors, diabetes, high blood pressure, high cholesterol. The thinking is that TIA alerts us that there's more to do, and so we normally at that time do more x-rays like ultrasounds, MRIs of the brain, checking other risk factors like cholesterol and diabetes, etc.
Okay, another question. What causes the brain zaps that occur when withdrawing from Cymbalta?
Well, all these medications, Cymbalta and other antidepressants, typically cause problems with the hormones in the brain in terms of rearranging them, the norepinephrine, that sort of thing. So when you stop the medications, it impacts the levels of those neurotransmitters in your brain. And so you get these physical symptoms from that. It's typically not dangerous, but if you can't tolerate it, a lot of times you have to get back on the medication and slowly taper the medication that you can tolerate. If you don't do that and you want to just tolerate it, sometimes it takes about 4 to 5 days, but it's just kind of the rearranging of the neurotransmitters that Cymbalta impacts. So when you stop taking it, then that impacts the levels as well, and that change is what causes that.
Okay, another question. How do you catch viral meningitis, and is there a cure?
It just depends on the type of viral meningitis. Herpes virus is one of those that's ubiquitous in the environment. We see that a lot in the elderly population. Some other viruses, mosquito-borne, that we've seen in the past, there's no cure for that. So most of the time for viral meningitis there is no cure. Herpes virus is the one that we can treat if it's diagnosed appropriately, but other viruses there is no cure.
Is there an extreme outbreak of the flu in our area?
I think we see the typical increase in the flu. I wouldn't say that was an extreme outbreak. We are prepped and ready to go for flu season typically, and so we did see a spike as we typically do every year. So I wouldn't say it was extreme. The patients are sick out there. And that's why I recommend flu vaccines, pneumonia vaccines, and getting into your doctor if you're under the weather. But I wouldn't say extreme, but expect it as we normally do this time of year.
Is it too late for a flu vaccine?
No, February actually is the last month, so if you haven't gotten it yet, you still can get it from most of the local pharmacies. Most patients have had a good experience with the pharmacies.
Okay. When getting a nuclear stress test, does the needle have to go in the top of the hand or does it go in the arm?
It doesn't really matter, just as long as it's in the vein, because they inject a nuclear compound which they take pictures of the circulation of the heart to see if you have any areas that are low flow or have no blood flow. They can take pictures of the heart. So as long as it's in the vein, it doesn't really matter.
Okay. Can hyperthyroidism, Graves' disease, cause the eyelids to swell?
Absolutely. The thyroid, either high or low, can cause a lot of physical symptoms. Typically, if it's low, it can cause that, and if it's very high, normally the eyeballs actually popping out or becoming more prominent is a classic feature of the Graves thyroid. It has to be pretty severe in that situation, so absolutely it can happen.
I think we can squeeze in one more question. What's the best medicine to take for sinus headaches?
The one that works for you, but I would try any of the over-the-counter sinus headache medication. Be aware of rebound headaches. If the headaches continue, certainly get to your doctor for CAT scan and maybe some other prophylactic medications such as Lyrica, Topamax, or Neurontin.
All right, Dr. Levine, as always, we appreciate you stopping by.